Hi, in today's video, we're going to talk about the heart, the the different area inside the heart, and the coronary circulation. So the heart has four chambers. It has the two upper part, which are called the right and left atrium, and the lower part, which are called the right and left ventricle. And apart from that, the heart has four valves, two atrioventricular valve, which mean that these are the valve between the atrium and ventricle. We have the between the right and left and right ventricle, we have the tricuspid valve, and between the left and the left atrium and left ventricle, we have the mitral valve or bicuspid valve. And we have those valves have a system that help reinforce them because their purpose, the valve, is to prevent blood from going back. So it allows the blood to go in only one direction. So we have the system that strengthens the valve to help it prevent the blood from going back is the system composed of papillary muscle. Here you can see them into the ventricles, the papillary muscles. And here you can see the white things that are poking out from the valve, which are called the tendinous cord or chordae tendineae. So we have the blood which flows through the heart. It drains through the superior vena cava here, which drain blood from the upper extremity of the body and empty into the right atrium. Also, the inferior vena cava retains the blood from the lower extremity into the right atrium also. And this blood is low on oxygen. And this blood flows from the right atrium to the right ventricle, and that's the mitral valve is opening for that to happen, and then the tricuspid valve open for the right atrium blood to flow into the right ventricle, and then after that, the papillary muscle and the chordae tendineae are going to close that valve and help it stay closed so that the blood do not go back into the right atrium but goes forward into the pulmonary trunk. Into the pulmonary trunk, it is going to divide into two main pulmonary artery and back into the lung. From the lung, it's going to recharge or replenishes with oxygen. Remember, the blood that flows from right side of the heart is low on oxygen. So the pulsar pressure of oxygen into that blood is very low. So from the lung, it is going to go back to the heart from four pulmonary veins. So the four pulmonary veins are linked to the left atrium, and this blood is high in partial pressure of oxygen, and it's going to the mitral valve is going to open. Same thing, the chordae tendineae, the papillary muscles are going to make sure that this valve closes and the blood doesn't flow back. And from the left ventricle, it is going back through the aorta and into the entire body. But we know that the heart is also a muscle. We study it, the cardiac muscles, and muscles are made of cells also, and the cells of the heart not also needs oxygen. That is why we have the coronary circulation. The coronary circulation is a system where the heart gets nutrient for its cells, its component. So we have the aorta, which is divided in three parts. We have the ascending aorta, the aortic arc, and we have the descending aorta. From the ascending aorta is where the we're going to have the coronary artery, which are the artery that gives blood to the heart, sorry. So we have the aorta, which is the only blood vessels in the body, in the heart, sorry, which provide nutrient for the entire body. So the aorta is the only nutrient that can, the only artery which can provide blood for the heart. So the coronary artery arises from the ascending aorta into right coronary artery and left coronary artery. The right coronary artery in itself is going to branch into the marginal branch and up here, you can see in the posterior view, and into the posterior interventricular um, posterior interventricular artery. And we have the the left coronary, which is going to branch out into the circumflex here, which is an artery that goes around the heart. You can see it here in the posterior view also, how it goes around the heart. And also we have the interior interventricular artery. And also, how do the heart goes back? So we have three main veins. We have the great cardiac vein. We have the great cardiac vein. We have the marginal vein, and we have the posterior interventricular vein, which is going to compose or drain. All three of those veins are going to go back here into the coronary sinus and into the coronary sinus through the right atrium so that it can replenish, get blood, and go back all over again. So this is all for the heart. Thank you for watching.